Branches of popliteal artery are anterior tibial artery, this one. Что я сейчас сказала? Anterior, yes. Anterior tibial artery is this one, arteria tibialis anterior. This one, yes, arteria tibialis anterior. It goes forward through the opening in the interosseous membrane of the leg to supply anterior surface. And posterior tibial artery, arteria tibialis posterior, that goes downward and supplies posterior side of the leg. But before it terminates into its terminal branches, it gives 5 more branches which participate in formation of arterial network around the knee joint. They are superior medial and lateral genicular artery, inferior medial and lateral genicular artery, and middle genicular artery. So this one is superior medial genicular artery. This one, no, it supplies knee joint, and also it supplies muscles which are inserted to the medial condyle of the tibia, which are semi-membranous, semi-tendinous muscle. Yes, superior lateral I cannot see in this preparation. It goes upward and laterally. There is also middle genicular artery that goes just forward. This one is middle genicular artery that goes forward, and it enters articular cavity of the knee joint, and it supplies knee joint. And there is also inferior medial and inferior lateral genicular arteries. This one is inferior medial genicular. Inferior medial genicular artery that supplies medial head of the gastrocnemius muscle. And here there must be this one, yes, inferior lateral genicular artery that supplies lateral head of gastrocnemius muscle. So all these 5 participates in formation of arterial network of the knee joint. Yes. Так. 1, 2, 3.
5, 3, 8.
Now 8. Yes. Okay. So then arteries which supply the leg. Here we can see posterior tibial artery. Not this one. This one. Posterior tibial artery, arteria tibialis posterior. This one. It goes downward in the cruropopliteal canal. How cruropopliteal canal is formed, you will also revise. And after that, when it reaches the end of the cruropopliteal canal, it passes under the flexor retinaculum. How flexor retinaculum is formed, you will also revise. And it continues to the foot, where it gets divided into its 2 terminal branches, medial plantar artery and lateral plantar artery. Here I think we do not see anything. Okay, but before this bifurcation, it also gives some other branches. So it gives 2 branches in the proximal one third. It gives peroneal branch. We cannot see it here, but peroneal or fibular branch that goes to supply lateral muscles, a lateral group of the leg muscles. Yes, it gives circumflex fibular artery, arteria circumflex fibula that supplies head of the fibula, and it also participates in formation of arterial network around the knee joint. Yes, and then it gives muscular branches which supply a posterior group of muscles of the leg. And here, in the distal one third, it gives calcaneal branch to supply calcaneal region. And then posterior tibial artery, yes, it continues to the foot. It gets divided into medial and lateral plantar artery. And this medial and lateral plantar artery, they form anastomosis with each other at the level of metatarsal bones, yes. And from this superficial plantar arch, first, like in the hand, yes, first common metatarsal arteries arise, then common plantar digital arteries, and then from each common plantar digital artery, proper plantar digital arteries arise to supply surfaces of the tooth. Here also cannot see anything. Okay. Also, lateral plantar artery gives arcuate branch that goes upward to form anastomosis with deep plantar artery from the dorsal artery of the foot to form anastomosis inside the foot to supply deep muscles of the foot. Okay, that was about posterior tibial artery. Anterior tibial artery, it passes through the opening in the interosseous membrane of the leg. Yes, and after that it lies on the anterior surface of the interosseous membrane. what here we can see it. This is nerve, but under the nerve here we can see artery. Yes, anterior tibial artery. That's it. It lies on the anterior surface of interosseous membrane. And it goes downward and it passes under the extensor retinaculum and continues in the foot as a dorsal artery of the foot. Here in the leg, it also gives two branches in the proximal part and two branches in the distal part. In proximal part, it gives anterior and posterior tibial recurrent arteries, which move upward and participate in formation of arterial network around the knee joint. In the distal part, it gives lateral, anterior lateral and anterior medial malleolar arteries, which supply medial and lateral malleolus on anterior surface. And certainly it gives muscular branches to supply muscles of anterior group of the leg. Then dorsal artery of the foot. Here it forms like arc also, and from this arc again dorsal metatarsal arteries arise, and dorsal common digital first, and then dorsal proper digital arteries. And from dorsal artery of the foot, arteria dorsalis pedis, deep plantar artery arises that goes inside and forms an anastomosis with arcuate branch from lateral plantar artery. These were arteries. Now veins. So like in the hand, like in the upper limb, there are superficial and deep veins. From plantar surface of the foot, venous drainage goes to the deep veins. And these deep veins, it's very easy. Yes, they have the same names like arteries, and they are usually paired. So there are two medial plantar veins, two lateral plantar veins. They join together, they form posterior tibial vein. What that's it, we can see it even. Posterior tibial vein, what, one and two, yes, two posterior tibial veins. This is artery between them. Then posterior tibial veins continue to the popliteal vein, then popliteal vein continue to the femoral vein and upward. Superficial veins, they collect venous blood from dorsal surface of the foot. And first, here there are proper dorsal digital veins, yes, then common dorsal digital veins, then common metatarsal veins, yes, and then they form dorsal venous arch. Here we can see this dorsal venous arch, and this dorsal venous arch continues to medial marginal vein, vena marginalis medialis, and lateral marginal vein, vena marginalis lateralis. Medial marginal vein that goes along the medial margin of the foot, it continues to vena saphena magna, greater saphenous vein, or long saphenous vein. Okay.
From the saphenous hiatus?
It drains at the level of saphenous hiatus, yes. So this one is vena saphena magna. It goes along the anteromedial surface of the leg and anteromedial surface of the thigh. And then, yes, at the level of saphenous hiatus, what is saphenous hiatus you will also have to revise. What, that's it. It drains into the femoral vein. Yes, drains into the femoral vein. At the same level with external pudendal veins. This is external pudendal vein. Okay. Lateral marginal vein continues to short saphenous vein or vena saphena parva. Short saphenous vein or vena saphena parva, which I don't see here. And this, it goes along the anterolateral surface of the leg, and then it drains into the popliteal vein. That's it. Okay. So, vessels of lower limbs you have to study, and here you should know how arterial network around the knee joint formed, yes, and all of these arches, blood supply of different groups of muscles, everything, yes, and also lymphoid system. In the lymphoid system, once again I'm telling you, you should know all the lecture material, you should revise structure of spleen, thymus. You should know how thoracic lymphatic duct is formed, at which level it is formed, what are the roots of the thoracic lymphatic duct, what are its tributaries, where does it drain. Yes, and the same about right lymphatic duct. You should know structure of lymph node also, and you should know what? The main groups of regional lymph nodes. So you should know how lymph outflows from different parts of our body, from right, left, hand, and so on. That's what you have to know. And that will be our last lesson, before zachет, of course. Any questions? Так, okay, now please take your seats.